Is a child's fever always bad, or does it help? Imagine your child has a fever, and your first instinct might be worry. But did you know that a fever is actually a sign that your child's body is fighting an infection? Fever is a natural response controlled by the brain's hypothalamus, which adjusts body temperature to help the immune system work better. Usually, a fever in children does not cause harm and can be a helpful part of healing. It often signals that the body is doing its job to fight off viruses or bacteria. Most fevers in children are short-lived and not dangerous. In fact, a moderate fever, which is usually below 40 degrees Celsius or 100 degrees Fahrenheit, rarely causes tissue damage. When a child's temperature rises above 40 degrees Celsius, it can be concerning, but it still often does not lead to long-term harm. Serious complications are more likely from the illness causing the fever, not the fever itself. Fever helps the immune system by making it easier for white blood cells to attack infections. It also slows down the growth of germs, giving the body a better chance to recover. Some studies show that children with fever tend to recover faster and have better outcomes in fighting infections. On the other hand, suppressing a fever with medications like acetaminophen or ibuprofen might sometimes delay recovery or make symptoms worse, especially if the fever is helping the body fight the illness. When managing a child's fever at home, the focus should be on keeping the child comfortable. If your child feels okay and the fever is mild, treatment might not be necessary. But if your child is uncomfortable or if the fever is high, you can give appropriate doses of fever-reducing medicine to help them rest. Always follow the instructions carefully and consult a healthcare professional if your child is very young, especially under 3 months old, or if they have other concerning symptoms like difficulty breathing, persistent vomiting, or lethargy. Monitoring your child's behavior and symptoms is key. If a child has a fever of 38 degrees Celsius or 100.4 degrees Fahrenheit and is under 3 months old, seek medical advice promptly. For older children, a higher fever or additional symptoms like rash, difficulty waking, or severe pain should also prompt a visit to the doctor. In summary, a fever in children is often a helpful sign that the body is fighting an infection. It is usually not harmful and can actually support recovery. The main goal is to keep your child comfortable and watch for signs of serious illness. Always consult healthcare professionals for personalized advice and treatment options. Remember, fever is part of the body's natural defense, and understanding its role can help you manage your child's health with confidence.